You will be greeted by our friendly staff, and we will be giving you a survey to fill out. The majority of the work that will be done will be around the proper diagnosis. We spend about 5 or 10 minutes getting your child in a proper position to evaluate the oral tissues, the muscles, the tongue, the lip. And then we spend a lot of time hearing your story. Every parent has a different story. The whole procedure takes less than 10 minutes. Our lasers allow us to provide this in a very safe environment without the need for general anesthesia, without the need for sedation or any other medication. And most infants are able to latch right after for a very successful and effective breastfeeding.
Once he identified it, he took him back. It took less than 5 minutes. When my son came back, he was in less discomfort than after he eats a meal.
The procedure, no joke, was about 4 minutes long. And my son took a nap that day.
Also, keep in mind that correcting your child's tongue function and mobility will not only have the short-term effects related to breastfeeding, but will have a number of positive effects that will carry on throughout their lives. As a father of 2 children, I have a personal experience knowing what you as a mom or dad are going through. My son was born with a tongue tie, and at the time, I didn't have the experience, the information, or the instrumentation to provide for him the treatment that I'm now providing. After 6 months of frustration, I was led to meet Dr. Larry Kotlow, and my professional life has never been the same. Being introduced to lasers didn't just change the way I practice, it changed my whole treatment philosophy. After the laser revision, I will give you all the information necessary to maintain an effective latch. Keep in mind, though, that this is a team effort. I need you to go back and see your lactation consultant and possibly work with someone who's qualified for some kind of body work, like craniosacral therapist. In the absence of a team effort, the effects cannot be maximized, and sometimes the benefits cannot be achieved 100%. You may come in with anxiety, questions, and a lot of stress, but I promise you, when you leave, you will leave with a smile on your face, knowing that you can now enjoy a much better bonding relationship with your infant.
It was quick, it was easy, and it didn't seem to cause him a whole lot of discomfort. And the best thing of the entire situation was he latched and nursed for the first time.
He napped twice today. He sleeps at night. He sleeps through the night. And I feel like I'm getting to know my son all over again. He's just happy. He plays. He doesn't scream all the time.
In all honesty, there is nothing more satisfying for my staff and I than to create a positive breastfeeding relationship and knowing that we made a difference in the lives of an infant, a mom, and a dad that visited our office.